Noncompliance of medication occurs when there is a misunderstanding between the patient and clinician. The patient may also be getting major side effects from their medication and choose to stop the medication. The patient also may not be getting the results they thought they will be getting, or they will be receiving quickly from taking the medication. The patient get frustrated and then they choose to stop taking the medication. Therapists can cope with this kind of problem with an open line of communication with their patient. Had the patient had the patient had the patient discuss about any problems they're having, and then the therapist can address the issues. They can come up with positive solutions that will benefit the patient and benefit the clinician to get the results they're looking for. Some patients don't understand the reason they have to take a medication for a long period of time, but a good explanation from the therapist will help them better understand and continue taking the medication. I also think that one of the reasons that medical noncompliance occurs frequently in society today is because when we turn the TV on to watch the evening news, or today even during the daytime, more pharmaceutical companies are advertising on TV about their medication and the results that a medication can perform on a person's body. And what happens is that regular TV viewers see that commercial, and then they want that kind of medication to get the results that the medication promised. Then they go to their doctor and ask the doctor to prescribe the medication. And in some cases, if you look at the bottom of the commercial, there's a small scroll that reads the side effects, and they say the side effects really low. And some people don't take into account that these side effects could affect me. So this is what happens. It leads to disillusion with some medication. Some patients are looking at the promise that the commercials make and are eager to take the medication. And as I said earlier, the results or the side effects are not what they are happy with. So this makes the patient question further use of this kind of medication or any medication. So this is the reason why many patients become medically non-compliant, because results are promised and do not occur. I also think some of the ways that doctors can avoid medical noncompliance is to address many issues that occur as the patient is taking the medication. They can also use a computerized system to track the patient use of the medication. And using a computerized system, what it does is that it helps other doctors or clinicians to look at the results that happen when medical noncompliance has taken place. Personally, I think in the long run is that open line of communication between doctor and patient will help everybody. This can reduce the amount of time the patient is using the medication. This can reduce the patient costs for having to continue going back to the doctor for further treatment. This also can reduce the patient anxiety, because they may feel that since this medication didn't work this time, a new medication will not work. Also, therapists helping patients get over medical noncompliance. This can save a lot of medication from getting wasted, because medication do have an expiration date, and when we don't use it, it expires, it becomes useless. So avoiding medical noncompliance can help everybody get better treatment.